In the fourth and final section of our lecture, now we will discuss about the treatment options for the pancreatic cancer. And the treatment options will be discussed in three separate type of tumors. If it's resectable disease, we can resect the tumor or not. If it's inoperable, locally advanced disease, or if it's metastatic disease. So all these different conditions can treat the treatment options we can do for the treatment of pancreatic cancer. If it's resectable, we can do the resection and then the grafting. Then in the second step, if it's inoperable, locally advanced. It's local advanced disease, but it reaches the stage when it becomes inoperable and we cannot perform surgery on that case, and treatment should be performed without the surgery. And then in the third stage, metastatic disease, is already metastasized to the distant sites, and in this case also then the treatment is more towards the palliative treatment and toward the chemotherapy and the drugs that can be tried to improve the condition. So the first resectable disease, in which there is a resection of the cancer is performed, and there is microscopic residual disease in about 30% of the cases. So 30% of the cases after the resection of the cancer is done, in this case there is residual disease is present, so it's not 100% effective even if it's a resectable disease. And 30% of the cases, usually they have the residual disease when examined microscopically. The treatment options for the resectable disease, which can be resected, we can do it by surgical procedures, RO resection, adjuvant chemotherapy, which is gemcitabine, and then we have pylorus preserving pancreaticoduodenectomy, adjuvant 5-fluorouracil-based CRT with gemcitabine before or after radiotherapy. So these are the treatment options for the resectable type of disease, in which resection can be performed, but after the resection also 30% of the cases, usually they have some form of residual disease left, and it's always important that after the surgery, that residual disease, which is about 30%, can be treated or should be treated with the chemotherapeutic agents or different other procedures. And the surgery is surgical with RO resection is done, and then adjuvant chemotherapy, which is usually by the gemcitabine. And pylorus preserving. Pylorus should be preserved when pancreaticoduodenectomy is performed. It should be pylorus preserving type of pancreaticoduodenectomy. Then we have, along with the gemcitabine, we should have 5-fluorouracil-based CRT along with gemcitabine is used before and after radiotherapy. The picture that gives the RO resection, we have internal jugular interposition. Graft is performed after the resection of the tumor. Inoperable locally advanced disease. Now, first choice was the one for the resectable disease, which is in which resection can be performed and is successful in about 70% of the cases, because there is a 30% residual disease on microscopic examination. The other condition is when there is inoperable disease, but it's locally advanced and there is no metastasis, but it's spread locally, infiltrated locally, and involve the local surrounding areas. If the pancreas, if we see, we have the pancreas, then we have biliary tree, then the duodenum, which is C-shaped structure. All these structures are locally and they can be infiltrated locally, but this disease again become inoperable. Locally advanced is unresectable because it's already advanced locally in the regional area. Consolidation radiotherapy is done for this inoperable type of locally advanced disease. The consolidation radiotherapy is performed for the tumor. Disease control on gemcitabine and erlotinib combination. So these are the treatment options for the inoperable type of pancreatic cancer, which is locally advanced. So only treatment options we have left with was the radiotherapy and then the chemotherapy. Surgery is out of question for this type of tumor or disease. So the disease, we do the radiotherapy, and then the disease is also controlled on gemcitabine and erlotinib combination. So in about 30% of the patients, we have this condition in which we found that the cancer or disease is at the inoperable, locally advanced stage. Then the third stage or condition in which the treatment option would be different is the metastatic disease. If the cancer is already metastasized to the distant side, which is the case in 60% of the patients, pancreatic cancer is rapidly progressive, rapidly metastasizing tumor. That's why the prognosis with this tumor is poor, and the early diagnostic imaging should be done to differentiate between the inflammatory condition and the malignancy, so early treatment can be started. But in most of the cases, that early diagnosis is not possible. And then once the disease is diagnosed, it's already metastasized to the distant site. So that's about 60% of the patients. In that case, distant metastasis, the treatment that can be done should be with the combination of paclitaxel with the gemcitabine. So that's the treatment for the combination treatment for metastatic disease. Then combination of capecitabine and gemcitabine, addition of erlotinib and 5-fluorouracil FA, irinotecan and oxaliplatin. These are the treatment options for the metastatic disease, which is in 60% of the cases. Surgery is not possible, and then these drugs are used to make the condition of the patient little comfortable and to ease the patient. But again, the pancreatic cancer is already metastasized in 60% of the cases, and the 5-year survival is now just 2%. So very, very bad prognosis at this stage when it's already metastasized. These are such drugs and their drug combinations that can be tried for the treatment treatment of the pancreatic cancer once it's metastasized. So that concludes our lecture topic, carcinoma of the pancreas, which is the organ present in the C-shaped structure and in the duodenum also, and very closely related to the liver and the gallbladder and the biliary ducts, and can cause abnormalities in the production of the insulin, can have both benign and malignant tumors. Malignancy is very fast and rapidly spread, and prognosis is very poor. So that concluded our lecture, and thank you for watching sqadia.com.